Hey guys, it's Hina Sheth here at Rebalance Physical Therapy. And today I want to talk to all of you guys out there who might be suffering or dealing with some sort of rectal pain, burning, itching, numbness, whatever in that area. And chances are maybe you guys already went and saw a specialist or maybe your internist, and because you thought maybe it was just a hemorrhoid, or maybe worse, were you fearful it was something bigger like cancer or something like that? And you go and you talk to your doctor and they don't find anything and they have no idea what it is. And if you thought it was a hemorrhoid, they looked at it and they said, you know what, hemorrhoids usually don't cause this much pain. We're not really sure what it is. So I want to tell you that it could be a group of muscles down in your pelvis that could be causing this pain. Now I'm going to give you a little bit of anatomy lesson. This is a model of the pelvis. This is a female pelvis, but the pelvic in both a male and a female, the pelvis, is roughly pretty much the same, except men, you have a penis, and women, you have a vagina. So that's the major difference when it comes to the anatomy, especially pertinent to what I'm going to be talking about. So here's a model of the pelvis. These are the two pelvic bones. They attach in the front to form the pubic bone, and in the back, they attach to the back to help connect to a bone called the sacrum, as well as the sacrum attaches to the tailbone. Now, if you look at this big red area right over here, these are muscles, and these are muscles called the pelvic floor muscles, and there's several muscles there. And you can see, now again, this is a female model, so for men, you won't have this area because this is the vaginal area, which is only in a female. But you do have the urethra, and you also have the rectum, which is right here, which is what you might be dealing with, okay? Now you can see these muscles span through all of these openings. So if you are having discomfort in this area, these muscles most likely could be involved, okay? Now, what happens specifically to these muscles? Now, if you are dealing with a pain issue, it is highly likely that you might be having tensioning in these muscles. Tensioning meaning tightness, restrictions, and you can basically get taut bands in these muscles, otherwise known as trigger points, and those taut bands can create pain locally in and around the rectum, or it can even spread outward for men into the penis, testicular, scrotal area, even into the groin, and for females, it can give you pain into the vaginal area, abdomen, groin as well. Okay, so what is this equivalent to? So this could be equivalent to, how you can feel tension in muscles in your neck, okay? Everyone has had neck pain or headaches or things like that, and you get that knot in your neck. Well, the same thing can happen in this area, okay? So why does this happen? Well, there can be many different reasons why these muscles can get tensioned. Everything from daily stress that you might be internalizing into the body, okay? And again, just to go back to the neck and the headache as an example, when you are stressed out, when you have tension, oftentimes we may feel it in the neck, and you feel that knot, and you just want somebody to give you a massage in those neck muscles, and that sometimes helps, and it helps you feel better. It gets rid of the headache or the neck pain. Well, the same thing can happen in these muscles in the pelvis. This is actually one of the most common areas that people can actually develop tension just through daily stress and anxiety, and it actually can manifest in these muscles. Other things that can create discomfort in this area, perhaps you have had some type of surgery in and around the abdomen, the hip. So for all of you guys that have had hip replacements or any type of labral surgery or any type of surgery around the hip, okay? Any abdominal surgeries, okay? So especially for you women who have had C-sections and even, deliveries through the vaginal area, to low back pain, okay? How many of you guys are having issues with your low back? Probably so many of you guys. So maybe these could be predisposing factors that could have created or led to pain in this area. Other things that could create issues here is if you've had any type of bladder issue, or stomach gastrointestinal issues. So many of you guys who might be suffering from constipation, irritable bowel syndrome, urologic diagnoses such as like endometriosis or PCOS, or possibly, any other vaginal gynecologic condition, that can actually also create tension in these muscles and give you pain in the rectum. So this is just a few. There can be many, many more. Now, what do you do about it? Well, fortunately, there are specialists out there, physical therapists, that work on pelvic floor muscles, okay, that can really give you a comprehensive guidance on what might be going on in and around this area. Now, you have to see a pelvic floor therapist that actually has a good comprehensive grasp of what's going on in the low back, the pelvis, the hip, and the pelvic floor. They need to be able to assess all of this together and really be knowledgeable in treating this area. And they need to be able to treat both the inside, okay, treat internally, as well as externally on all the other muscles that surround this area. Now, what do physical therapists do? Well, everything from aligning and making sure that the pelvis, the hip, the low back is all completely aligned, to all the muscles that attach to this area, both inside, okay, including the pelvic floor, and in the outside, to make sure that there's a good harmonious balance in these muscles so that everything isn't compensating. And so it's a no-brainer. If you live in the Philadelphia area or on the surrounding Philadelphia suburbs, then, come see us, because this is what we treat pretty much 90% of our day. This is what we specialize in low back, spine, pelvic, and hip problems, pain, and dysfunction. And if you don't live in this area and you need guidance on finding a pelvic floor physical therapist, then come to our website, okay? Shoot us an email and we can help you find a specialist in your area. You yourself can also possibly Google search and find a pelvic floor physical therapist in your area. But if you can't, come to our website. We also have lots of helpful tips and information and free reports that you can download that might help you get started on what you can start doing to kind of get control of this pain until you find a specialist that can really help you. So I hope this has been helpful. Shoot us an email. We can help you in any way that we can. And I hope this has been helpful. So don't let this rectal discomfort take away more from living your life. And we're here to help. So I hope this has been helpful, and I will talk to you soon. Thanks.